I think the mental aspect in having a respiratory disease is it's always present. When you can't breathe, nothing else matters. And when you dwell on the fact that you can't breathe, it's just burdensome. You do your best not to raise anxiety of your loved ones or yourself. So it's always a balance in working not only on your own wellness, but on those of the folks around you. I was really lucky that I had the support of an entire community around me. I sat on their shoulders. They held me up for a dozen years before I really got my transplant. And a year after I did, I was on par, and I took a staff role at the Alpha-1 Foundation. So take care of yourself first, explain things to your family, be really vocal about what you need, because the anxiety, the mental wellness is completely tied to your success with any disease, but certainly respiratory. The usual prognosis will give you 2 years to live. Well, 13 years after that, I received a double lung transplant. You turn your entire language around from looking for lungs, into it's such a gift. It's been a journey, one that I'm happy to be on, one that I would not recommend. My diagnosis is multi-pronged, right? It was the misdiagnosis, it was the final diagnosis, and then it was the prognosis, and ultimately a double lung transplant, and years later, an injury, a brain injury that made these things different. I think it's important for every patient to share their story. I think when patients share their story, you can get allied health professionals to really know not only you and the clinical part of it, but what matters most to you. I walk in every single time knowing where I want to get to go, knowing where I've been, where I don't want to get back to, and I have real conversations about my goals. There are always going to be medical goals, but if they don't align with what I want to do, we need to have different conversations. And if people are going to hear my story and work differently, or diagnose Alpha-1 and cut down on that time from misdiagnosis to a real firm diagnosis and then treatments and then finding more patients in their practice, I've won. We come in with being empowered and accountable because of programs at ATS, because of things that we've learned in advocacy organization. We come in educated. We're really ready to participate in our care, in our treatment, our long-term survival and success. We want shared decision-making. When I was first diagnosed, I was the first Alpha-1 patient the physician had ever seen. He never expected to see one. We talked about a little bit the paragraph that he had seen in a textbook during med school. And I just knew he wasn't the fit for me. I wanted someone to be a little bit more aggressive. But fast forward to my walking the halls in this ATS conference, I came across someone who works on Alpha-1 testing. And I asked her how it was going and where the hotspots are and where they're finding patients. Is the message getting out? Is the treatment getting out? Are patients participating in research? Do we have the same culture? And she said, I'm doing really well where you live. I have this one particular doctor that is finding patients like crazy. He's been testing forever. He is the most consistent in finding patients, and I was patient 0. So my educating him, my ultimately firing him was impactful. It is absolutely vital that you don't work alone. There is no best nor better nor treatment without walking up to that line and crossing it with your peers, with your patients, and everyone that needs it. To become a fellow at ATS gives you that forum to walk up, erase the line, and move forward. You can't do it alone. I've met great doctors in the world, and I'd lay my life down for them, but they can't change this. They need the ATSs of the world.